All right, so we're coming in for the home stretch here, and we're going to draw the extensor zones, but first we have to draw the bones, right? Which we've all become. Let me see if I can get this a little closer. I can, but then I can't do it. All right, so we're going to draw the bones like this. I bet my friend Jenny will have no problem drawing. She's such a good artist. All right, there we go. I don't know if I have another one there or not, but here we go. So we're going to do zone 1 over the DIP. And zone 2 over the middle of P2. Zone 3 is the PIP joint. Zone 4 is the middle of P1. Zone 5 is the MP joints. Zone 6 is the metacarpals. Zone 7 is the extensor retinaculum. All right, got it? There we go. Okay, now we're going to move to the small finger. And we're just going to draw those dorsal digital arteries. And I'm not going to draw the bones this time. And we're basically drawing this just to talk about it, right? We've done a lot of blood supply today. So these are the terminal bifurcation of the dorsal metacarpal arteries. And well, let's just pretend these are the dorsal metacarpal arteries. There you go. These two work together to provide the primary blood supply to the MP and IP joints, as well as the phalanges, the bones, the soft tissue of the finger. So a lot of responsibility. All right, so then we're going to turn around and draw along the side here. And now you do want to draw some bones. Okay, so now what we're going to try to do is our collateral ligaments. So we have the accessory, which have a fan-like presentation, and the proper, which have a cord-like presentation. Hopefully y'all can see that. There we go. All right, so these go toward the dorsum, or the fan-like. So this goes like this. Proper, proper, proper. Accessory and proper. Accessory, proper. And the proper is the one with the cord-like presentation. Accessory is the one with the fan-like presentation. And I always got this confused, but the collaterals at the metacarpal are taut in flexion. And I would bend the finger, but it's not bendable to show. But they're taut in flexion and loose in extension. And the IPs are taut in extension and loose in flexion. So it does kind of matter, you know, when we place these patients in these splints. Yes, it's nice to get them in intrinsic plus, but they can get tight there too. So that's usually the ideal splint position, but still can be a problem. Okay, now we're going to go down to the radius and the ulna. And I'm just going to wipe some of this off so we can draw it, okay? So we're going to draw the radius first. What do I even palpate to see where the bone is, because it's not a real hand? And I'm assuming this is kind of a styloid. So we'll be kind of hopeful here that it looks something like an ulna, which it does not. Okay. Now what we're going to do is come down here and mark the Lister's tubercle right here. And Lister's tubercle is a problem for some people with arthritis because the EPL tendon comes across, it goes up here, and it gets stuck sometimes, or over the years they get, it doesn't slide like it's supposed to, and it can rupture. It can rupture in people that don't have arthritis as well. So then we're going to come now and we're going to create a TFCC. And we're going to bring this across like this. And we're going to make a little disc. And we know that the ulna doesn't really touch the carpal bones, so we need this TFCC to create a cushion for the DRUJ. There we go. All right, so the TFCC includes the articular disc that joins the sigmoid notch of the radius to the styloid process of the ulna, and it has a whole bunch of other carpal ligaments that I didn't mention, or ligaments between the two of them, but one of them is the ECU, sheath of the ECU. So many times we know that the patient has a distal radius fracture, and then they always complain over here about pain in the TFCC. And so over time, we just hope that it gets better. We hope that it gets healed. But sometimes they might have really done something so bad that they tore it or they jarred it, so it might need some repair. But it's a very complicated area that can cause people a lot of discomfort and pain. So that is the hand. That is the majority of what we've drawn today. And you guys have done a great job with participating with me, and I really appreciate that. And I have just the one last picture to show, which was of the EPL, sensor pollicis longus. And then there's the unhappy Lister's tubercle. So, thank you very much.